Hi all. Just seeing if we're live. Are we there? So I've not been live here very much, if at all. I don't know if I've done a live in the group yet. So I thought I would pop in and have a quick chat with you all. I'm just trying to make sure that the video is up on my phone because I can see the comments as they come through. Hopefully that's kicked in now. Bear with me. I know we're not a very big community here yet, but hopefully that's growing. And if you see me and you can share my page for me, I would be really, really grateful. Some of you might already have seen a live I did earlier on my aesthetics page, but obviously this is a different thing, and I've separated out all the stuff I do for that reason. I'm not picking up here, so I might have to just go cold and see if I pick up any comments on my laptop. So hopefully you're all here now, and if anybody wants to know anything, please do stick comments in the whatchamacallit thingy. So sorry, I'm a little bit distracted. Right, I've got what I want. Just if anybody asks any questions, then I'll see it on there as well, just in case I missed them on the laptop. So you might have read the blurb that I wrote about what I'm doing this live about and why I'm here. Just to go through a little bit about the process and how I approach it as a nurse. One of the things that I have quite a few people say to me is that they don't like some of the processes out there in relation to piercing. Now, I'm not averse to going to tattoo places for piercing, things like that. In fact, I had my intragus done just 3 weeks ago at Vivid Ink around the corner. It was fine. But what I did discover on my training is that the general feel about what sterile means is a little bit different to how I see it. And we are putting holes in the skin. So for the most part, I think people get away with it, but I want to approach things slightly differently. And so what I'm going to do is talk you through my process, how I go about body and ear piercing, and also a little bit about the differences between earlobe piercing with a gun and with a needle, and why you would choose either. A lot of people say they would never ever use a gun ever, and I'll talk you through why both are options and why or when you might choose either of those options. So when we are putting holes in people, now I do this on a regular basis with aesthetics. I do Botox and fillers. I am injecting into far more high risk areas with fillers than I do with piercings. And so I'm very used to handling needles. I'm very used to managing sharps and the waste, sort of subsequent what you do with sharps afterwards, body fluids, how to manage those, and also my sterile area and how I manage that with my clients to minimize the risks of infection. Now, it's impossible to completely avoid those risks, and a lot of those risks come afterwards as well with what the client does once they leave me. But the more I can do actually at the event and on the occasion of aesthetics or piercing, and the advice I can give post procedure is really, really important. And the last thing you want is an infection. I had a chat with somebody today who was talking about a friend whose young daughter had managed to get away with getting some body piercings that she was too young to have, had gone somewhere that perhaps was less scrupulous in their procedures, didn't tell mum and dad that she'd got these areas pierced. They went on a holiday, she got horribly infected, was kind of bedded down for the holiday, it kind of ruined the holiday, and it just reminded me of why I do what I did. And that was kind of the prompt for me to do this video today, to explain why my age requirements are as they are as well, and what I require to prove that you're the age that you are. You need to be old enough to manage some of these after you've had them done as well. So procedure, first of all, it's the most important thing, regardless of which area you are having pierced. The lowest risk area is probably the earlobes, and the lowest risk in some respects from a cleanliness point of view, if it's done properly, is gun piercing, because you handle very little of the sort of process yourself. So all of my clients, the first thing I would do before we start looking at where they're having it pierced, is clean the general area. If somebody's got lots of hair, I will ask them to tie it back. If I need to, I'd use a hairband to stop lots of wispy hair getting in the way when I'm trying to fiddle around behind ears and get earrings in and things like that. All of these things carry risk of infection. So clearing the area that we need is the first thing that I would want to do. And then I would clean the skin around the whole area. So if I'm doing a helix piercing, for example, I would clean the whole of the ear, top and bottom, back and front, to make sure that, because I will be handling the whole ear, I'll be doing this, depending on what area we're piercing. And so I need to make sure that I'm not picking up bacteria and moving it around as well. So I would clean the whole area. A bit difficult when people have got lots of existing piercings. In an ideal world, I would have a completely sort of clear ear with no jewellery. That's not always possible. And so I would mitigate that as much as I can myself. So the product that I use for cleaning the skin is Cleanliness. It's a surgical option for skin cleaning. It's the one that I use for aesthetics. And to me, this is a much better product to use than alcohol for the skin. It's kinder on the skin as well, which is really important because we don't want to irritate skin that we're about to do a procedure on. We want to keep the skin as clean as possible. No harsh chemicals in this. It smells like a swimming pool, actually. So it does smell like bleach, but it's not bleach. It's sodium hypochlorite, and it kills at least as many germs and bacteria as alcohol. Now, the alcohol that I use is just for cleaning instruments before they're sterilised, and I'll talk through my sterilising process in a minute as well. So this is still a useful product for me, but I don't use it on the skin, generally speaking. A lot of places use alcohol wipes. That was ruled out in hospitals, generally speaking, quite a long time ago. We tend not to do that, unless it's changed again and we've gone back to them. But certainly when I was in hospitals, we generally didn't use sort of sterets and things like that for most procedures. Sometimes they're quick and convenient if you don't have an alternative. I do have sterets as well if I need them, but generally speaking, it's Cleanliness. The marker pen would be used with actually I haven't got one to hand, I haven't got them out, but another, I would touch the end with a cocktail stick and use that to move across, so we're not using this on multiple people. And then the client would then prove where we're marking and things like that. If we're using the spray anaesthetic, that would go on right at the last minute, and that's a spray, it doesn't touch anything. And it's it's a cold spray that just numbs the surface for 30-40 seconds or so. And if it's on an area around the face, generally you'd put that on a clean cotton pad and press it to the area. If it's on belly buttons, nipples, that kind of thing, you can spray directly on the area. Have to be careful of that because it smudges your dots, so you need to make sure you know where you're going. Now, from an equipment point of view, I was very keen to not be reusing equipment on people, and I wasn't happy with just wiping over with alcohol. The clamps that you use, if you can see, they're ridged. Can you see that there's ridges on those? So if you've got bacteria in there, it's going to be very hard to get that off with a quick wipe with an alcohol spray and a cloth. So I've got loads of these. And so what I do is I wash these in hot soapy water using an antibacterial wash. They are left to air dry on clean paper towels, and then I would wipe them over with the alcohol at the end. They will then go into sterilising bags. So these sterilising bags will then go in my autoclave, and every single bit of equipment is sterilised before I use it on a client. Now, that I know doesn't always happen, and for the most part people are probably getting away with it. I'm not here to criticise other practices. I decided I wanted to do it slightly differently, and everybody has the choice of where they go and how they approach those procedures. It's not how I was taught. How I was taught wasn't as sterile as I have chosen to do it. My instinct as a nurse and the fact that I'm putting needles in people all of the time meant that I kind of almost don't have a choice in this. This is how I need to do it to feel safe to practice. So everything I use is sterile. All of my jewellery, when I get it from the wholesalers, is also put into these bags, are all ready to go in the steriliser. I've just been bagging them up this afternoon. So they are all sterilised and put in the bags. They will stay in that until the first time I open that for someone else. Once that's open, they will then go in these, which have been pre-sterilised inside. So these jewels aren't actually sterile now, but they are clinically clean. They will be removed when someone's chosen them with the sterile forceps. And then, before it goes into a hole, a newly made hole, they will be put into a sterilised glass pot and cleaned in my LED steriliser. So it's kind of a real belt and braces approach as to how I clean, so that I know that when that goes in somebody, it is as clean as I can possibly make it, given that this isn't an aseptic environment. It's clean, it's clinically clean, it's as sterile as I can make it, and this way is belt and braces. So if there is any kind of bugs picked up as I handle that and move it around, it's as clean as it can possibly be. That's the jewellery. It's also how we clean these. And then these are all, like I said, cleaned in antibacterial wash, air dried, alcoholed, sterilised. And that's so nobody is going to be repeating with these. And that includes scissors, because scissors are often used to cut the tubes down on the needles. And speaking of the needles, obviously, and I think most people know this now, your needles will be individual use, pre-packed, sterile. If you are going somewhere for piercing, you need to make sure that you see these opened in front of you, that you know that this is your needle. I'm pretty sure the majority of places, particularly anywhere that I've been to in Lichfield, you know, they are doing that. And I think most people these days do. But if you're concerned when you go into somewhere and, you know, you think perhaps the routines here aren't quite what I'd want them to be, the very least you need to be seeing is that your needle is pre-packed, sterile, and they open it just for you. If I'm doing 2 areas on somebody, I use 2 needles. I did 2 areas on one person today, 2 different ear piercings, and I don't reuse that needle even between the areas. So that needle would go straight in the sharps box, the cannula bit would go straight in the sharps box, and we use a second one for the second piercing. There's no reusing of anything on anybody, even if it's on the same person. So that's how I do that. My sterility myself, for the most part, for any needle piercing, I will be opening a pack of sterile gloves. These packs of sterile gloves also give me a sterile field that I can then work on. My trolley that I use will be cleaned with, you see that green, it's over that shoulder, can't do it, I can't do it, that there, that is all back to front. That pot there of green wipes are for sanitising my trolley, and also the couch which is behind me. That would be wiped down between every single person. When I do anything with needles, this is left exposed with removable and disposable paper. When I do other things, sometimes I'll put comfier things like blankets and towels and things on there, but for anything that is sterile, generally speaking, that will be wiped down, clean paper, which is thrown away at the end. So for most of my needle piercings, you'll have sterile gloves, although I've been struggling with them today. It's been so hot. I think my hands have swollen up. I couldn't get them on properly, so that was a bit of an effort earlier on. But then I know that when I pick up that jewel that comes out in its little pot out of my steriliser, that my hands are clean, that when I touch the client, my hands are clean, and it's just mitigating risk all the way along the process as much as possible. For body piercings, so belly buttons and nipples, bear in mind I don't do anything below that, I'm not ready to go there yet. I will be using an aseptic dressing pack. It's a bigger area. I want sterile gauze and things like that, particularly if I'm doing more than one body area at a time. This just gives me a bigger aseptic, bigger sterile field as well, and more options basically. Or if I was to do, if I knew somebody was coming in, I was doing 2 or 3 areas all at the same time, I'd probably get a sterile dressing pack rather than just the sterile gloves. This may change as I go through, but at the minute my nurse brain needs me to do it this way and be sterile. So that's kind of a run through of how I'm managing infection control risk, because it's really important and something that I can't see myself not doing. I need to make sure that I know I've done everything as clean as I feasibly can. And if anybody's got any questions on any of that, then please do message me and, you know, ping me questions through on the thread, and I will happily go through that with you. So the last thing to talk about then is the differences between needle and gun piercing. I haven't talked about sterility of needle piercing actually. So this is a lobe gun, whether you want to use one of these or not. They're all much the same. There's different ones out there. You'll find these in Claire's Accessories, and anywhere that does gun piercing, you'll find one of these. Now these are difficult to clean. You can't put them in the autoclave. And I can't immerse this in water because it's got springs and inner workings that would rust and it would stop working. So these are wiped with I can't do it, which way is it? The green wipes there, sprayed with my alcohol, and then put in my LED sterilizer, and that can be done fairly quickly. So I only need one gun because I can do that sterilizing process in a few minutes and it will be as clean as it possibly can be. Now there are no parts of this that touch the client. Okay, so that makes it a little bit easier to manage, and I'm going to show you how that works. And I'll tell you in a minute why we would still, like I said, there are people who don't want to use these, and that's fine, you don't have to. Needle is always an option. Now I can't find my little spare set, hold on. I had kept a spare set of this out and I don't know where I've put it now. I'll see if I can find it for later. But anyway, no, I've obviously hidden that somewhere out of my own reach. I really thought I had it for you, never mind. But basically it comes with a sterile cartridge that drops onto the end, and you drop the earring into here, so nothing is touching that is going to be going into the client, and you literally line up your dots and it fires it straight in. Now a lot of people don't like guns, and to be fair, when I went on training I was like, no, I'm not going to be doing guns. However, the more of the process that I've looked into, if you have a young person, I'm insured from 8 years old. I don't intend to try and get insurance for younger than that. I don't see the need. 8 years old is fine by me. They can consent. Although they have to have an adult with them, I can say to them, are you happy to do this? And if they say no, then I'm not doing it, regardless of what the parents say. But it can be a little bit more frightening for little ones. That earring is put into the ear, the back is put on, and it's all done in one shot. Whereas with a needle, there's 3 processes. You've drawn on the ear. So the needle goes in with the clamps, the needle comes out, but it leaves the cannula in the ear. You put the earring in and pull through, and then you still have to put the back onto the earring. So there's 3 parts to that. It's said to be a cleaner hole and better healing, which may well be the case, and certainly is the only thing I would do to cartilage piercings. But for lobe piercings, generally speaking, if they're looked after, they tend to heal quite well. It's a much faster process. It kind of folds the skin in on itself a little bit, so it's very unusual to get bleeding. Whereas with needle piercings, you're far more likely to get bleeding, and that could be quite traumatic for a young child. So for young children, I would still probably say go gun, unless there's a particular reason not to. And one of those reasons is allergy. Most of the earrings that fit, the cartridges that fit in here, they are gold plate, or I've got a variety of different ones. But all of my piercing jewellery that I use for cartilage or for needle piercing is titanium. And titanium is the lowest risk for allergy. So if somebody is obviously and knowingly allergic to nickel, I would definitely be going down the needle piercing route, because you're far less likely to get an allergy to that, which means better healing, less irritation, less likely for the body to reject that jewellery, and more comfort in the long term. And if the child is not happy to do that, I would say wait until they're old enough to do that, rather than risk those problems with gun piercing. But if somebody has no known allergies, doesn't have any problems with jewellery, perhaps doesn't like needles, then gun is definitely the way to go. And you know, there shouldn't be any reason why that wouldn't heal well, as long as aftercare is taken into account. I'll do another video on aftercare on another time, but I wanted to cover both of these things today. So there is scope sometimes to do gun piercing, but it's only for earlobes, not for cartilage. I mean, many years ago I had this one done with a gun. I'm fortunate it's healed okay, but cartilage is much firmer, and guns go through too quick. It shatters cartilage and they can often not heal very well. So I've been quite lucky with this. Noses, cartilage piercings absolutely should not be done with anything other than a needle, and absolutely not with a gun. So if anybody has any other questions on that, I would be very happy to answer those. You can either PM me or message on this thread. I'm conscious, like I said, this isn't a very big population yet, but I'd love you to help me grow that. And if anybody wants to book anything, just click on the booking link on the page. I'll try and remember to drop it onto the thread here as well. I'll put this one out. I'll download this and put it onto my Instagram page as well. I'm excited about doing this. It just is a nice extension of what I've already been doing. I'm not scared to handle needles. I will make it as clean a procedure as I possibly can, and I will use the method of piercing that is right for you or for your child, to make sure you get the best result, the best healing, and you'll get my support afterwards as well. So nobody gets kind of abandoned. You all get good aftercare advice, products, and all that kind of thing. So it's been nice coming on and doing a live, finally introduced myself properly. And I'm hoping to see you all for some piercings in the clinic. And if you don't want piercings, come and have some aesthetics or laser hair removal. Have a great evening. I will see you soon. Bye.